There we go. All right, I would like to call the meeting to order for Tuesday, November the 26th, 2024 for the Renfrew County and District Board of Health. I would like to start by acknowledging that the Renfrew County and District Health Unit is located on the traditional territory of the Algonquin and Anishinaabe people. We honor the land and peoples of the Algonquin and Anishinaabe, whose ancestors have lived on this territory since time immemorial, and whose culture and presence have nurtured and continue to nurture this land. We honor all First Nations, Inuit, and Métis peoples, their elders, their ancestors, their valuable past and present contributions to this land. Miigwech. And now I would like to call for a resolution to approve the agenda. James, and seconded by Elder Ethel. All in favor?
Joanne, just before going forward, I just had a question in regards to the letter that was severed from the minutes at the last meeting. Is there a plan to address that in the agenda or as part of business arising from the minutes before the minutes are approved today?
No. When I have that motion, I believe it carried for the agenda to be approved. The letter's not on the agenda, James. It was severed. There was not tabled. It's dead. I've done research into Robert's rules and our bylaws. There is no requirement, and I don't believe there's any mechanism to bring the letter back. So we'll move on with our agenda and our business for today. Thank you. Are there any declarations of a conflict of interest? There are none declared. Thank you. There are no delegations.
Sorry, Joanne?
Yes.
Just you still have to do the vote on the acceptance of the agenda.
Oh, I thought I saw all the hands up. Pardon me. Can I see those hands again or on the agenda approval, please? Thank you. That's carried. Oh, I don't see Heather Czar. Did she send regrets, Melissa?
No, she hasn't.
Okay, thank you. Well, hopefully she's still planning to join us. So we'll look to the minutes of the previous meeting from October the 29th. Can I have a mover and a seconder? Carolyn and Troy, yes, thank you. Any concerns, questions? Mike? You're on mute. We still can't hear you for some reason, Mike.
How was that?
There you go.
Sorry, it was muted. In the section 6 of the minutes, I believe the meeting was held on June 25th, 2024, not June 24th.
The June minutes are not the ones that are on this agenda. That was oversight on the last agenda.
We were approving the minutes. It's in the minutes of the previous meeting that we're talking about. And in section 6
of those previous minutes. Oh, the error is in the minutes. Pardon me. There's a typo in the minutes on the date of the June meeting. Perfect. Thank you. That will be corrected. Perfect.
Okay.
Good. All in favor? That's carried. Thank you. Business arising. We will move into the staff reports and call up Jason.
Hi, good morning, everyone. So I've got a number of different updates for you today. I wanted to start off with Renfrew County and District Drug Strategy and give you a bit of a progress update on what's happening there. So our most recent meeting of the steering committee was earlier this month on November 14th. Before I get into that, though, I think I alluded to this at the last board meeting, but there was a collaborative that put in an application for a homelessness, addiction, recovery, and treatment hub, or HEART hub. And a lot of the members there are on the drug strategy or on the treatment working group in particular. And a great example of people coming together, many different organizations and agencies to submit a very strong application. And so we're hopeful that this will ultimately be successful, and looking forward to hearing back about that. I think by the end of the year or perhaps early next year. But we know that the province wants to move quickly on that, so we should it shouldn't be too long before we hear. So at the steering committee meeting this month, the focus was on distilling down the recommendations and the discussion that's happened thus far into a report with a situational assessment of what's going on right now, as well as a set of strategic priorities. And so we started that off with the harm reduction pillar, and presented sort of a demonstration or template report for discussion of those priorities themselves, as well as to inform the structure for the other working groups to use as they're developing their parts of the report. And so we're hoping to have all four of the pillars components of the report complete quite early next year, maybe even as early as the January steering committee meeting. And that will then allow us to proceed to further community engagement. We also discussed our planning around further community engagement, and some of the key aspects of that will be a survey, as well as likely some town halls to try to incorporate as much feedback on the draft recommendations as we can get. Some of the other work that's been going on, a lot of it around the communications subgroup of the drug strategy. And they've been working on an anti-stigma campaign that's been a collaborative among a number of different agencies, and involving social media posts, and has focused on compassion for people who use drugs and on the negative impact it can have on individuals, in particular with regards to their ability to access treatment and services in the community. And then another aspect this group has been working on that relates to one of the steering committee's recommendations is the promotion of a remote overdose detection service, which is actually an app called Brave, for people who have no choice but to use drugs alone to reduce the risk of a fatal overdose. Also related to the drug strategy, I wanted to touch on some of the indicators thus far this year that we're monitoring. So far this year, there have been 25 suspect drug-related deaths, which is fewer than at the same time last year. There have been 78 emergency department visits confirmed that are related to opioids, which is a bit more than last year. However, in recent weeks, the number of emergency department visits has been decreasing. So I included a graph here in the report that you can see on the x-axis, or the horizontal axis, is the week number throughout 2024. And on the y-axis is the number of visits in each of those weeks. And this goes until about November 10th. And you can see that in recent weeks, there have been fewer emergency department visits, with there being about 2 visits in the last 9 weeks. In all of 2023, there were, just for reference, there were 41 suspect drug-related deaths and 69 opioid-related emergency department visits. And just wanted to note that clearly there's still far too many deaths that have occurred in 2024, but there is some indication that the number is decreasing relative to last year. And I also just wanted to touch on that it's very difficult or really impossible at this time to attribute the changes that we're seeing to any one thing in particular. In a relatively small health unit such as ours, there can be substantial year-to-year variation. And and so one of the key aspects of the drug strategy is to broaden the indicators that we have available to inform our evaluation framework and see what's working and what's not. But I do think it's important to note the substantial progress that's been made to the work of a number of different partners. Of note, the MESA initiative. There's also working together on the drug strategy, and then continuing to onboard new partners for naloxone distribution, which I'll touch on in a minute, as well as numerous other initiatives. So in a related sense, but kind of zooming in on RCDHU specifically, I wanted to update you on our harm reduction program and a number of different accomplishments that this team has been able to achieve. So the first is around increasing access to naloxone, which is, as you know, is a life-saving intervention that can reduce or reverse overdoses from opioids. And so it's an important aspect of our strategy to reduce deaths related to drugs. So this year so far, we've distributed 3,466 naloxone doses with our partners through the Ontario Naloxone Program, and that's more than any other year. So for comparison, in 2023, we distributed about 2,800 doses. And then we've also doubled the number of partners through the Ontario Naloxone Program from 7 to 14. So really pleased to see that collaborative attitude from our community agencies and that are coming together to continue to increase this service to the community. Another area of work of the team is providing training sessions on naloxone and safe sharps disposal, and they provided 172 of those so far this year. And then just looking at harm reduction services broadly between both our CDHU and our partners, we've had about 1,900 client service encounters that we've been able to provide so far in 2024, which again is more than any other year, and compares to about 1,500 in all of 2023. And then since June, our team has been deployed a new outreach program across Renfrew County and District to broaden the individuals that we're able to reach. And that so far this year is comprised about 16% of all of our service appointments in harm reduction. And one of the interesting things that we've noted about this aspect of our programming is that nearly all of the encounters are with unique individuals. So it really shows that it is increasing the reach of our program throughout the community. So shifting gears, I wanted to touch on You're the Chef. So this is a grade 5 to 8 food literacy program that's a train the trainer model. So we train the educators who then in turn provide the program. Provides hands-on skills and it also links to the curriculum. And so one of the newer areas here is that the Youth Wellness Hub has received training and is able to offer this at their Pembroke and Renfrew locations. Then we're also seeing some increased demand for the program. And so we're offering multiple training opportunities this fall. Now on to our health protection division and in particular immunization. I'll start off with an update on how things are going with COVID and flu immunization for the fall season. So as of November 6th, which is what I have on here, we had administered about 1,500 doses of COVID vaccine and about 1,400 of flu. We've also dispensed almost 19,000 flu doses to our healthcare partners and 1,100 COVID vaccine doses to the same partners. What we're seeing is that pharmacies continue to be the dominant distribution channel. However, in our area, public health is still doing quite a large proportion of the immunization relative to what's seen in other health units. And so I'll just, it's not written here, but I'll just give you the most up-to-date data that I just received today. About 29% of all the COVID immunization across our health unit area has been by public health, by RCDHU, and then about 64% by pharmacies. And currently we have 8.6% of residents who have received the newest, most up-to-date COVID vaccine dose, and about 30% of people in our Renfrew County District who are 75 or older. So these numbers are lower than we'd like to see. However, they are approximately the same as the province. And we'll be continuing to run our immunization clinics and promote access to the service. And we hope to see ongoing increased uptake as the fall and winter season progresses. Next, I can update you on our RSV infant program. So just as a reminder, this is involving the passive immunization agent called Nursivimab, or Beyfortus is the brand name. And it's available for all babies under 1 year of age in our area, as well as high-risk children, and provides protection against RSV infection, which is particularly important in these very young age groups. So we're offering clinics to provide it to this population. People can also access it through their primary care provider. And for babies that are being born during the season, it's offered as well at their birthing hospital. And so far between PRH, Pembroke Regional Hospital, and RCDHU, we've administered 61 doses, and we've distributed 314 to primary care. Then on to grade 7 immunization. This is our yearly initiative where we provide to our grade 7 students vaccination against hepatitis B, meningococcal disease, and HPV. This year we've had 1,100 students eligible, and we've completed our first wave of immunization. And depending on the vaccine, we've administered about 630 to 720 doses. And then lastly, I just wanted to provide you a verbal update on the Immunization of School Pupils Act and our implementation of that act, also known as ISPA. So for some background on this, this is legislation that outlines the requirements for students attending school in Ontario to have a set of routine immunizations that are specified through the legislation. And over recent years and throughout COVID-19, our resources, like other health units across Ontario, were quite challenged. And so we did not have the same resources to implement and enforce ISPA, which has contributed to the part of the public health backlog and reduced rates of routine immunizations in some childhood age groups. But what will be happening this year is we'll be returning to our completely normal process. Basically, over COVID, what we tend to do is we give out several notices about, to students who are behind on their immunizations and their families, and then offer opportunities for catch up. Then there is also the potential for suspension if it's not eventually addressed. However, over COVID-19 and in recent years, we did not progress to the level of suspension, both again because of resources, but also because of the various disruptions to school throughout the pandemic and wanting to give people time to reset and address this. But as with our neighboring health units, this year we will be proceeding to our normal processes. We always issue a first notice and a second notice for any students who are behind on their immunizations or where we're just missing information in some cases. And then as a last resort, we will, if the immunization is still not up to date and as per the legislation, we will issue a notice about a potential suspension. Again, we never want to get to that point, and we'll bend over backwards to work with families so that they can get up to date with their vaccines. We offer clinics, and people can also go to their healthcare providers to get the up-to-date immunizations. However, I just wanted to let the board know that this would be coming up this year. As of our data right now, we have nearly 3,600 students that are overdue as per our records for different vaccines, and nearly 700 where we have no information. And as we go through the process, we will see those numbers drop drastically, as we go throughout the year. So on to the next section on healthy environments and our vector-borne disease programming. Just wanted to update you that our fall season tick dragging, which we also call active surveillance, has been completed. And as of now, we have 2 additional confirmed risk areas where we've been able to confirm the presence of deer ticks in both the spring and the fall. And so that is areas near Petawawa and Eganville. And then we have one potential one that still needs to be confirmed that's near Pembroke. And then also just to note, out of the ticks that we've received from the public this year, the deer ticks that have been tested so far had a positivity rate for the bacteria that causes Lyme disease of about 16%. And then my next update under healthy environments, I just wanted to note that this is Radon Awareness Month. And so we're doing some knowledge translation activities around that and working with partners. For some background on this, radon is a natural gas that exists in the environment. It's odorless, and you can't see it. So there's no way to know it's there basically without testing. But why it's of a concern is it can enter indoor spaces in particular people's homes and build up to levels where it can become harmful. And as a result, in Canada, it's the second leading cause of lung cancer. And as I said, the only way to know if it's present is to test for its presence in a house. So we're working with schools and municipalities to share information about this. And I've also got the link there to takeactionradon.com.ca where you can access more information. Moving on to our emergency response program, I just wanted to note this has been an active area of focus for us over the past year, and there's been a number of different accomplishments. So we've run several simulations and tabletop exercises, and I've noted those there. They include a debrief of our previous respiratory illness season. We also, in the summer, ran a large opioid overdose incident response simulation. And then more recently, we led a tabletop exercise with partners to help us prepare for the respiratory illness season and ensure we're as coordinated and working together as much as possible. Also, our emergency management coordinator took on a leadership role and co-presented with Ottawa Public Health at the Emergency Management Ontario Capital Sector meeting earlier this year, and the main topic being the public health role in emergencies. So that enhanced our partnerships and also awareness of public health role in responding to emergencies. And then lastly, at our quarterly public health grand rounds, we provided an emergency management orientation to all staff, thereby increasing competencies in this area throughout the health unit. And then my second last area is on infectious diseases. Just quickly note the situation with respiratory illnesses in Renfrew County and District. So overall, this activity has been stable since the last update. COVID-19 remains quite active. We still have no confirmed flu, and it remains low throughout the province. But as always, every winter, we do expect that to begin increasing shortly. RSV is showing its signs of starting to increase across the province. So we're already seeing the beginning of that. And just noting that our respiratory-related hospital bed admissions and our emergency department visits are both at high levels. And then on to whooping cough. Wanted to update you on this and the increased activity we're seeing with whooping cough. So far this year, we've had 11 cases, and that's compared to no cases over the prior 5 years, so it's quite an increase. Across Ontario as a whole, we're seeing the highest rate since 2007. Our staff are very actively working on this and following up with each individual who tests positive to provide education, do contact tracing, and then when it's appropriate, administering prophylactic antibiotics. And just wanted to note, as before, that immunization is the best way to protect against whooping cough. And the immunization for this can be accessed through RCDHU clinics or through people's healthcare providers. And I just urge anyone, residents, to contact us or their healthcare provider to review whether they're up to date if they have questions or to find out how to get vaccinated. And then lastly, I just wanted to note that our Director of Health Protection, Vicky Benoit, will be retiring as of the end of this month. And I just wanted to express my and the health unit's gratitude for her immense contributions. She's been with Renfrew County and District for over 24 years. And just to name a couple of things, Vicky's had her contributions will be felt for RCDHU forever, but just to know some of the things she's worked on, she was a major leader in our response to COVID-19, which, as you know, is the most significant pandemic we've seen in 100 years. It's been a very busy time as well for new immunizations, and she's led the rollout of many new vaccination programs across Renfrew County and District. And she's also played a strong role in supporting our increased public health outreach that we've been engaging in over the last year or so. And I just wanted to note that I've personally really appreciated working with Vicky and having her experiences and insights in my time since I started at RCDHU. She's going to be greatly missed, and just wanted to wish Vicky a happy retirement. So thanks, Vicky, and that's my report, and happy to discuss or answer any questions.
Let's see, Jennifer.
Thank you, and through you, Jason, as always, an amazing report. Just a couple of things. Is there any plan, number one, to roll out You're the Chef into other primary schools?
Actually, the program, I believe, is available for all primary schools. It has to do with their interest, and if they have the capacity to undergo the training, we would happily provide. You know, as I said, it's our train the trainer model. We'd happily provide that training so that they can provide You're the Chef in their schools.
That's excellent. It's such a great program. I'm going to check in with both my primaries. Secondly, radon. I've been asked about this quite a bit, just recently, in fact. So it was timely being in your report. The hyperlink, I didn't get much out of. It used to be, I've been told, I cannot confirm nor deny, that radon test kits used to be given out by our CDHU. And I'm just wondering, is there an easy way for people to test?
Thank you. I believe in the past we were able to offer radon test kits through a special initiative that was underway where we received funding to do so. Unfortunately, we don't currently have access to that at this point in time. However, our general recommendation is to use a long-term radon test. Generally, you'd put it in the space that you're testing for about 3 months, and then you mail out the test to get your results back. There is a cost associated with it. I think it was around $50 the last time I checked.
Okay. So sort of a Life Labs for radon. Got it.
Exactly.
All
Yeah.
right. And finally, just congratulations to Vicky. That's all I had on your report. Thanks so much.
Problem.
And I see Troy. Yes, Troy.
First of all, thanks, Dr. Morgenstern, for your report. And I just wanted to say thank you very much for your hard work in terms of the drug strategy. I think it's really showing some real promise in terms of addressing these. And I know it's a collaborated approach, and I think we're starting to see some of those successes. You talked about expanding in terms of the metrics or the indicators for the opiate overdose concerns. One thing that I did recognize is that, maybe because I'm kind of concerned about the two presenting at Pembroke Regional Hospital over the last 9 weeks. So my fear is that, based on the OPP stats, that we see the response to the overdoses are happening, out in the field. And maybe those individuals are not reporting to PRH, and they're addressing those issues through naloxone distribution, and that's rightfully so, because we're seeing the expansion in terms of the naloxone partners going from 7 to 14. So and including the the doses that are being distributed. So is there any way that you think that we should be promoting those individuals once they receive naloxone to report to the hospital? Because I think we're seeing, or maybe just looking at those metrics that we're getting from the OPP that are responding to overdoses, because I seem to think that they're not jiving right now. So I'm just thinking there's an opportunity there to me when you're looking at your expansion of the metrics or indicators to look at that as well. And then I think the other thing is I also just wanted to wish, just so I can let you do your response, but I also wanted to thank Vicky for her contribution for Renfrew County District Health Unit, and I wish her all the very best in her coming retirement. So back to you, Jason.
Thanks. Yeah, so I think that's a really important point. The metrics that I'm showing you today are only one angle on the problem, and I want us to have as broad a view of what's going on as possible. So thank you for noting the statistics from the OPP. I think that would be very important to incorporate that into our evaluation framework. And as you noted, I think when somebody receives naloxone, generally the recommendation is always to have follow-up medical care. However, we have to respect the person's wishes, and they don't always want to engage in that. And so, in terms of ultimately, we want to prevent deaths. And so it appears that we may be having some success in that given the reduction we have seen since last year. And so naloxone helps in that regard, but it's not the be all end all, that's for sure. So we we want people to have comprehensive medical care. So finding ways that we can improve that, and it may not be through the hospital, perhaps it would be through the Heart Hub as once that's hopefully established. So we need to have all aspects of the problem in our indicator framework. So thanks.
And so Elder Ethel, did you have your hand up earlier? Yes, I thought so. And then I saw Peter, Neil, and James. Thank you, Ethel.
Thank you. Congratulations, Vicki. Thank you for your great work on behalf of Renfrew County Health residents. Much appreciated. I'm going to try not to personalize this, but I'm just wondering, Dr. Morgenstern, if the health unit is aware, which I'm sure you are, that many of the pharmacies are not carrying tests for COVID, and the rare pharmacies that are carrying it are at $14.99 for two kits. And so I think that I know that the government, we don't record numbers anymore, how many or whatever, but my concern is that there are people walking around with COVID, either not knowing they have COVID or not caring to get tested because one, they may not be able to afford $14.99, or they may say, why am I paying to do a test which nobody really cares about? So I guess my question is, are we still concerned with COVID, which I believe we are? And how do we kind of get around this? $14.99 may not mean a lot of money to some people, but to some it may mean a whole lot. It may mean some food. So I'm just concerned.
Thanks for raising that important issue. What I can say is, unfortunately, we received direction from the province in the last month that we are not to be distributing rapid antigen tests as we were before to the public. So as of right now, that's limited to certain particularly vulnerable settings, in particular long-term care homes and retirement homes where those tests are available. And so while I wholeheartedly agree, we are still quite concerned about COVID. Unfortunately, for the general community, they are only available through those channels, like you said, pharmacies or grocery stores. And we're aware of the limited availability. Ourselves and other health units have advocated about this to the province and noted the limited availability. And I think they're taking that into consideration. But unfortunately, we're somewhat limited in what we can do at the moment. I mean, and then just to highlight where it is still particularly important to be testing, I think for many people, the messaging for respiratory illnesses is sort of the same at this point. Regardless, it's to isolate it till symptoms improve for 24 hours and there's no new symptoms, and then to wear a mask in public settings for 10 days after symptom onset when you're going out and about. So that's recommendation is there. However, we have Paxlovid, a medication that treats COVID and can reduce severe outcomes in people that are at higher risk, and the largest group being those over the age of 60. And so in that group, it's and others with medical comorbidities that put them at higher risk from COVID, it's important to have access to testing, and we would still recommend that. As I noted, unfortunately, the options are limited right now. So I know it's not really a satisfactory response, but thank you for noting that.
Thank you. And
Supplementary.
oh, yeah, okay, yes.
So I don't want to belabor this, but you raised a very important point, Dr. Morgenstern. I think as a health unit, we should be writing a letter to the government telling them how uncomfortable this is and how wrong this is. To say don't distribute or don't do this and don't do that. I'm just really concerned.
Thank you, Mayor LaValle. Thank you, Elder Ethel. And I want to welcome Jim Mannion, who was having some technical difficulties, and thank you for joining us. Glad you're here. And just so you know, on the agenda, we're under staff reports, and we've had a presentation on the Medical Officer of Health report to the board, and we're now undertaking questions. And next up is Peter.
Thank you, and to Jason, through the chair. In your report with naloxone, you talk about doubling the distribution from 7 to 14, and it says partners. So I think, if you could be just a little clearer on that, there's not just 14 sites around the county where people can get those. There's probably, maybe a couple of hundred kits out in the community at any one time. If you could just elaborate on that, because I don't want people to think there's only 14.
Sure. Yeah. So that is specifically the number of agencies, organizations that they could have multiple sites where they're providing it. And that's only through the Ontario naloxone program. It's a bit confusing because there's different arms of this program. So another arm of the program is that naloxone is also available at any pharmacy, any participating pharmacy, which I believe is virtually any pharmacy. And they actually distribute higher numbers than what I was reporting to you. So, we'll have that by the end of the year, but likely we are far outstripping even more than I've indicated the number of naloxone kits that were distributed last year.
Thank you.
All right. Next up is Neil and then James.
Awesome. Thank you, Joanne. I love the report, and yes, congratulations, Vicky. Thank you for 24 years. I had 3 questions for you, Jason. The first one, and they're kind of from a board perspective, but the You're the Chef program, love it. I think it's a very positive way for us to try to address food scarcity, food poverty, all of those things that we know exist in our communities. Is there any need for the board to work with the school boards to ensure that this program is accepted and wholeheartedly adopted in all 4 school boards? Is there something that we can do? And Joanne, I got 2 other to follow up after that.
Thank you for your support of the program. I really appreciate that. Why don't I take that back and discuss with the team if there's any further ways or if we're running into any barriers that the board might be able to help with. My understanding is that the school boards have been quite receptive and in uptaking the program where they can. Patty, I don't know if you wanted to add anything to what I was saying.
Thank you, Jason and Neil. Yeah, I think I concur with Jason's approach to take it back. We're really in an exciting sort of place with, as mentioning, that we're expanding it. So I'm thinking at the next board report, we could probably bring back an update with, where we're expanding to in the current situation with continued interest with our school partners. We do have a strong relationship with both boards, and we're really great. We have a lot of gratitude for that. But I think that duly noted that I think it's nice to see where we may have more allyship, but we'll take that back.
Awesome. Thank you. The second one has to do with radon, Jason. And I just quickly Googled for a map of radon potential threats in Ontario. And what I noticed is that there are elevated and high areas within our district that have a potential threat of radon. And I know the efforts you're making are well within the parameters we have set with the budget and everything else. But this concern to me kind of aligns with firefighting and fire alarms and CO2 detectors. Can we partner with the municipalities, especially the municipalities that have high and elevated areas of threat? And maybe by partnering with the fire chiefs and the municipalities, we can actually pass the information more readily to the residents that have these threats. And I'll just forward that link in the chat here.
Thank you. Yes, certainly. We have been sharing information with the municipality, with our municipal partners about radon and the different testing and mitigation measures and those sorts of things. I can explore if there's more we can do to advance that and what kind of response we've been getting, and in particular around the fire departments. So I'll follow up on that.
Awesome. Good. And the last one is you mentioned it in the report. You added to the report just about the relative comparison of how much vaccination Renfrew County District is doing versus other similar districts. And I think you said 26%. And I just wanted to see if there was anything else behind that comment. Is there a reason we're higher? Is there something that we're not doing? What can the board do, if anything? That was my last question. Thanks, Joanne.
Sure. I think that we're at an appropriate level. It's generally what we see across the province is the more northern health units are doing more of the direct immunization, and I think that has to do with access to pharmacies and access to primary care. So we're really just trying to meet the need that exists in the community. So I think it's appropriate. I just wanted to, provide that background so that you have that.
Great, thank you. And James.
Thank you, Joanne. And yeah, first and foremost, congratulations, Vicky, and best of luck in your retirement. I have a couple questions, Joanne. The first one, just kind of a follow-up to Troy's comment on gathering more data as far as the number of overdoses and use of naloxone. Through the police service boards or through the community safety and well-being plans, does that data and information get to the health unit, or is it something that you have to make a request for? I'm just curious how that information flows.
Sure. So the information that I presented today, we get through totally different sources, through the coroner and through what's called the National Ambulatory Care System, or NACRS. So that's one piece. I think the data that Troy was alluding to, we do not automatically get that at this point. I think that's something that we're hoping through the drug strategy and through data sharing agreements that we will accomplish sort of a more automatic, and not just with police, but with many different partners, sharing of pooling of information so that we have a better picture of what's going on across the county as a whole, and through the sort of array of different contacts people have with agencies and with the services.
Thank you for that. And maybe through the whole MESA initiative, some of that information can flow as well. Certainly something that Peter might have a little more availability or access to garner some of that information. Second question is in regards to, again, I think this You're the Chef program is a fantastic initiative. I really think that sometimes there's that gap in education for nutrition and food preparation. I'm also wondering, because I know recently the province has signed an agreement with the federal government on more sustainable funding for the breakfast program. Has Renfrew County, are we able to access some of that? Is this a province-wide program, and how is that money rolled out to the different health units, if in fact we are getting it?
Thanks for the question. Yeah, I think that's great news. I believe it's around 108 million or something additional to the school nutrition programs across the province. We're not involved directly in administering that, but my understanding is, as with the rest of the province, Renfrew County will be receiving some benefit from that additional funding for local schools.
Thank you. And just one final question, and in regards to vaccinations and the increase in and not just whooping cough, I know measles is on the increase as well, and I'm assuming that's a result of the gap in having those vaccinations up to date. Are you getting a sense that there are more families who are pushing back because they don't believe that in the whole vaccine programs and the benefits?
It's a difficult question to answer. We don't have great local statistics on vaccine hesitancy per se. I know that with national surveys, there has been some indication, at least with particular vaccines, about some potential for increases in vaccine hesitancy. However, I think what we've been finding through most of our immunization programming is still quite a high receptivity and interest in vaccination, and as long as the service is being provided. Um, Vicky, I don't know if you wanted to provide any further background from your perspective.
Thank you, Jason. We do collect some data with our ISPA, so that's with our school immunization program. We have seen a slight increase with those who choose not to vaccinate their children. And I think we've seen that across the province. And we're certainly, we do provide education to the families who do choose not to vaccinate their children because they do have to go through a program through the health unit, as well as sign an affidavit to decline vaccination. But, we have seen a slight increase since the pandemic. And we're certainly, providing as much information. But again, our rates are certainly the highest in the province. I think we're really successful in immunizing our children that are in school. And certainly more work to be done. But again, there's been a lot of discussion around vaccine hesitancy and how to address vaccine hesitancy. So I think there's still some work. Not necessarily that our families, that our children that are not vaccinated, they may have started their vaccination but have decided not to continue. So again, those are factors that we're looking into, and there's a lot of discussion around that and more information to come and how we can address that. And I think that's really key in public health is addressing the vaccine hesitancy.
That's excellent. Seeing no further questions, I'm going to ask for a resolution to approve the report of the MOH, moved by Jennifer, seconded by Peter. All in favor? And that is carried. Thank you very much. And we will bring up Heather, our CEO, for her report. Thanks, Heather.
Thank you and good morning. So first of all, I want to echo everyone's sentiments and say thank you to Vicky for her commitment to our CDHU over the past 24 years. We do wish you all the best for your well-deserved retirement, and you will be missed. On to ministry updates. Work continues on the public health standards, and we will continue to plan with existing protocols and guidelines that they contain until further notice. There's also no further updates on mergers or funding announcements, but we're monitoring for any news. The fall economic statement was issued by the province, but it didn't have any mention of public health directly. Alpha is watching and waiting for further announcements and working on their submissions on our behalf. The receipt of the financial settlement letter for 2022 closes all but one outstanding year with the ministry. So they've done a great job in 2024 to bring things pretty well up to date. I thought I'd highlight the current quarter activities in the context of our strategic directions from the strategic plan to help illustrate the activities that are currently underway at our CDHU. So under strategic direction number 2 is partnerships. And I was elected to the executive of the AOPHBA, which is the Association of Ontario Public Health Business Administrators, which is quite a mouthful. And this is the association looking after all things business and corporate for public health units. This will be a good opportunity for collaboration and developing partnerships with members of other health units. The Workplace Wellness Strategic Direction number 3, we're hosting Meg Soper, who is a motivational humorous speaker tomorrow afternoon at the Best Western in Pembroke. This is for all staff, and we are closing for the afternoon in order that everyone can attend. We've also launched a leadership development program which will continue over 6 months to foster growth and development for our managers. It will focus on practical leadership skills, coaching for team effectiveness, and strengthening communication skills. Under strategic direction number 4 is communications. And we will be providing media and spokesperson training to a group of the management team that have external communications as part of their role. This will build capacity for media and other external engagements for public health issues and emergency response situations that can arise from time to time. This will also strengthen their ability to develop effective messages and narratives. Under risk management, staff will be attending on-site in-person cybersecurity training sessions in December to help foster awareness of threats and prepare for effective defenses. We all know that there's heightened risks these days, and this will help both in their professional and personal lives. And as risk management is an ongoing activity throughout the year, but at this time of year, we begin the planning process for 2025. So I thought it was timely to include a brief refresher in my report on the process, as I think it'll be helpful for our board members. So just briefly, definition of risk, a future event that may impact the achievement of established objectives, and mitigation strategies are used to reduce the negative risks or increase opportunities for positive outcomes. So those are two terms that are used frequently, but nice to have a bit of a definition around those. The risks for RCDHU and their controls are identified, assessed, and evaluated using the ministry's risk management strategy and process toolkit. And this document accompanies our quarterly reports that Tom presents. The toolkit is a risk management framework adapted by Corinne Bernstein, I think is how you pronounce her name. She was with the Ontario, or is with the Ontario Treasury Board Secretariat, and the Ministry of Health, their reporting requirements mirrors this framework. So we are in line with the ministry requirements. The framework was adopted by the RCDHU board in 2017, and it is available for all board members as a resource on the board portal. So it is in the document folder, item 18, risk management, and I encourage everyone to go there should they want to get more information and background and history. And if you need some help, I can assist, or Melissa can assist with that. And over the, so back to the planning activities, over the course of the risk planning meetings, staff review mitigation strategies and modify or amend as required. Action items are then assigned to all the risks that are identified. But of the risks that are identified, the 10 highest ones are summarized and presented to the board. This will be in the 2025 corporate operational plan with risk mitigation strategies, and that will come early in the new year. These items are then actively monitored by SMT throughout the year against the planned mitigation strategies. And we report to the board throughout the year and to the ministry as part of their Q3 report for 2025. So I hope that gives just a little bit more illumination to the topic of risk management and how we work it at RCDHU. And that is my report for today. Thank you.
Thank you, Heather. And I can echo and now myself as well, the congratulations to Vicky. Just take that moment as we keep going around the circle today, Vicky, which is awesome. And also, Heather, congratulations on the financial settlement, getting caught up. I know that's always a relief when the government agrees with our presentation of our audit and reconciliation reports. So good work for you and the team, and hopefully they'll get the rest of the way caught up soon, and that's always a good feeling. Are there any questions for Heather or other comments? Yes, Jennifer, and then Peter.
Thank you. I just did I freeze on you guys?
No, you're okay.
Good.
You're still here.
Excellent. So in your strategic partnerships, you mentioned all levels of government. Is there going to be continued discussions with the County of Renfrew and how we can assist in, different faculties that maybe we're missing at our CDHU?
Yes, thank you, Jennifer. Yes, that is definitely how we left our conversations with the County of Renfrew CAO, and we will continue to have conversations and see what opportunities for sharing, and with the other two obligated municipalities as well.
And then Peter, you had your hand up also.
Yes, thank you. Thank you for the report. And Heather,
And Neil.
congratulations. Congratulations on joining Alpha, the Alpha board. Very important for us and for you. It's necessary to get our voice outside of our geographic boundaries. And in terms of training, last month we spoke about some staff going off to the Alpha conference or the Alpha training session, the webinar on governance. Did that occur, and was it of benefit to the staff? Or I'm not sure if you would have had a report on it, but I'm just curious on a follow-up. And I'm glad to see the information in your report about training. Thank you.
Thank you. Yes, Melissa attended that training event. It was for the senior administrative team. Melissa, did the other two, did we have other attendees as well? Sorry to put you on the spot, but.
Yes, Heather, we had two other senior AAs attend.
Okay. And you would rate the event as?
Oh, it was great. Very beneficial.
Excellent. Okay.
Thank you, Heather. And then I have Neil and James. Neil?
Awesome. Thank you, Joanne. Heather, I didn't know that risk report was in that document list. And I love that because I went in there the other day to look at that document list and thought, oh my God, I don't know what any of this stuff is. Well, I appreciate you pulling it out. And if there are other ones in there that you think should be highlighted, I'd encourage you to do that in subsequent meetings. When I previewed the risk assessment, it keeps referring back to 2017. So is it just a 2017 document that's updated off in a different portal? And this is just the legacy document? Is there a 2024 one is the question.
Thank you, Neil. Yes, that is the 2017 document. So what we can do is look at what material would best suit keeping that information current for the board. So I think for 2025, once we finish our planning and have that, we can have that information updated. But that is like the core and foundational document where all the work was done to develop the risk register, which it had, I think, there's about 50 items on I'm not sure the total right now, but there was about 50 items. So you can see why we have to highlight the 10.
No, that's perfect. Thank you, Heather.
Okay.
And James.
Thank you, Joanne. And in the beginning of your report, Heather, you referred to the province working on the Ontario Public Health Services update. I'm just curious if, is that one of the reasons, I should say, why we're not hearing any more about the province's new funding agreement for the health units that I think, is that supposed to come into effect in 2025 or is it 26? And I'm wondering are they trying to update this Ontario Public Health Service document before they then look at the funding?
Yes, so that funding announcement was to take effect 2026. They were going to be announcing early in 2025. I'm not sure if that's going to happen. And I believe they were 3 separate activities: the review of the public health standards, the mergers, and the funding. So, but so I can't really say if one has a bearing on the other. Jason, do you have any thoughts on that or anything to add?
Yeah, I mean, similarly, it's hard to know exactly how the ministry's working. They did sort of give a rough order, and I think the funding was supposed to be determined last out of the 3 areas, and presumably they would be, taking into account the changes to the standards somewhat, but they haven't explicitly said that to us, but it could be a factor. And we do know that the standards development is delayed, and they've indicated the new funding approach will also likely be delayed, but the originally scheduled announcement of it was supposed to be in the spring of 2025, and we haven't received an update on what that may change to.
It's all due to the election maybe as well.
Mm-hmm.
Yeah.
Mm-hmm. I do not see any other hands up. Did I miss anyone? Just taking one look at the screen again. Seeing no further questions, I'll call for a motion to approve the CEO report. Troy, seconded by Carolyn. All in favor? And that is carried. Thank you. So being that it's just 2 minutes after 11, I'm proposing like a 5-minute, 6-minute bio break right now. If that's okay with everybody, take a quick stretch and come back at approximately 10 minutes after 11. That'll give us a 7-minute. But if I see everybody back before that, we'll relaunch. Thank you. Hi, Heather. I'm glad you got in.
Oh, I'm so sorry. I had an appointment in Pembroke and I thought I'd be back in lots of time, but there was 2 huge car accidents in 41.
Ooh,
So I was behind those and got quite delayed. So excuse me.
no worries. I'm glad you're okay. That's the main thing. And just so you know, we were just taking a brief break. We're going to start up again here in a couple minutes. And in terms
That's
of the
fine.
agenda, the item that's coming up next will be the board committee reports.
Okay, okay. I'm sorry you probably discussed the letter. I'm sorry I wasn't there for discussion.
No worries.
Okay.
Joanne, it's Melissa. I sent you a
Yes.
message.
Oh, okay.
Thank you.
Melissa, there was a big car accident right in front of your sister's house.
Oh my, when you said that, my heart, I think about family members, right?
Yeah,
Like everybody
yeah.
in that area.
I hear you. And
many-
because there's a whole lot more snow in Pembroke than there is here.
Really?
Yeah,
And
it was.
there were 2 accidents? Where was the other?
The other was at the corner of Sawmill and 41.
Oh, okay.
Yeah, that was an even more huge one than the one. This car was obviously heading to Pembroke, but obviously going too fast and was right almost upside down across in the ditch where that rock cut is.
I was gonna say the rock cut right there.
Yeah, yeah. So,
Oh.
yeah, it's just, I don't know. Nobody seems to know how to drive properly in the first
Yeah.
snowfall.
Yeah.
Sorry about that, everyone. I'm fostering my daughter's dog, so now I have 2 big dogs. So hopefully they'll stay on the porch now. And we've got 1 more minute before our break is over, so we'll resume in a minute. I'm glad you're okay, Heather. That's the main thing. And I hope everybody else in those accidents was okay.
Yeah.
I'm sure it's keeping our paramedic team very busy today.
Yeah. Yes, because I saw 2 ambulances going with their sirens and then a fire truck as well. So yeah, it's not a good day. I'm kind of surprised the school buses weren't closed, or canceled in Pembroke as well. But anyways, I guess
Some of them,
it's
yeah,
they make the best guess, right?
some of them were canceled out here for sure.
Yeah.
Some of the buses were canceled,
Yeah.
but all right, we're at 10 after, and let's see, we have maybe not quite but yeah, I think everybody's almost all back, I think. There's Heather. Yeah. I know Melissa was here too, because she just spoke to me a minute ago. So I think we can resume the meeting, and as everyone who's just coming back in noticed, we do have Heather here, and luckily she's fine and was delayed due to car accidents on Highway 41, if you didn't hear that. So it's a scary day out there, I guess.
Yeah.
And we're now going to resume the agenda at item 9, the board committee reports. And I'll call up Mike DeManoir for the resource committee, please.
Thank you, Joanne. The Resources Committee met a week ago yesterday. And for information, the Q3 2024 unaudited financial report was reviewed. There were no concerns identified during the meeting nor from staff. The notables were that at the end of September, we were at 74% of the current budget, which is a nice tracking. The amending agreement with the ministry was received in June. The seniors dental was 82% spent, but that was because of an early focus on dentures earlier in the year in the first half. And HBHC funding was increased by 6.9%, which would help to address some of the inflationary pressures that have been experienced on it for a number of years, quite frankly. If anybody has any questions of a technical nature, I would refer those to Janet. on that. Insurance renewal documents have been filed, and at this time, we're still waiting for quotes to come back. The action list had no items that were referred to the committee for attention. The big item of business that we dealt with was the municipal levy report and the preliminary draft budget. And maybe on that one, I would turn it over to Heather and Janet to address, if that's okay with you. Walk us through it.
Sure. Thank you, Mike.
Okay, thanks, Heather.
So we reviewed the a 2025 draft budget and discussed the assumptions that we used to prepare the municipal levy request. So base funding from the province for the core programs will increase by 1% next year. And that will apply to the full calendar year. In prior years, they had it apply April 1st. So this has made it easier. COVID-19 does remain part of the mandatory program service requirements, but special funding from the ministry is not anticipated in 2025. So we will stay tuned and see if there is anything that will come. But at this time, nothing's been promised. So that is an assumption. Combined payroll and benefit costs for the mandatory programs make up 88% of our total mandatory program costs for our CDHU. Our wage contracts include a 2% cost of living adjustment for 2025. Benefit costs in 2024 benefit costs for 2025, that should read, are not yet known. My apologies. So the benefit costs for 2024 are not yet known, applied to the full year to get the percentage. So for the purposes of this estimate, an allocation of 26.5% of wages is being applied. Cost savings opportunities continue to be looked for and sought while ensuring program and service delivery according to the Ontario Public Health Standards, the ones that are in existence at this time. Resources are being shared with other health units and services are being purchased to enhance service breadth where possible, while also optimizing efficiency and supporting some staff absences. And in this bullet point, I would add that we will continue to work with the obligated municipalities to find shared service opportunities, purchase opportunities, and cost savings opportunities. The recommendation for the municipal funding requirement for 2025 is an increase of $77,419, bringing the new total levy to $2,354,449. When combined with the provincial base funding, the overall increase to RCDHU's mandatory programs budget would be approximately 1.6%. Our mitigation strategies have allowed us to somewhat diminish the impact of the 2% wage increase in 2025. The recommended municipal contribution would result in a cost sharing for mandatory programs between the province and the local obligated municipalities of 73-27. This split does not include seniors dental, healthy babies, healthy children, and unorganized territory funding received from the province, because that funding is received at 100%. But all of the remaining mandatory programs are split along that 73-27%. The proportion of the municipal levy allocated to each municipality is again calculated based on the 2022 MPAC population statistics, and it will continue with that calculation until 2026 when new statistics become available. So that's the general overview. Does that help, Mike?
Yes, thank you. I think we probably just should go to questions.
And I see James's hand, but what I was wondering, like from a process point of view, do we not need a motion on the floor and then we discuss? I think so, because I think what I'll do is call for a motion to accept the report first, Mike. Mike is moving it, seconded by Troy. Thank you very much. Now we can, and now James. Thank you, James.
Thank you, Joanne. Just a couple comments, and I'll start with the one about shared services, and especially as it pertains to insurance and the cyber insurance. The LAS program that's available for all of the municipalities does provide group purchasing for those two items. And I was wondering if that's something, not sure if you'd have time this year, but something that the health unit could explore as far as maybe finding some more favorable rates. And secondly, I would just like to explore the possibility of there's a couple of things based on the fact that the health unit is in the process of trying to get charitable status, which I think is a wonderful initiative. And also the fact that we don't know yet what the new funding arrangement from the province will be. For this year alone, I would maybe like to recommend that we amend the resolution to adopt the levy and the draft budget to say that we would cover that out of the Renfrew County District Health Unit reserves.
Sorry, Joanne, are you looking for somebody, if James is suggesting an amended motion, then if somebody seconds it, then we can talk about it, but right now we're kind of stuck.
You're on mute, Joanne.
Thanks. As a mover, do you consider that a friendly amendment?
Not particularly.
No, so yeah, it would
That's a
need
big, that's a big change to the existing
Yeah.
recommendation. So.
And I don't know what the impact of that would be on our security blanket for the future, which is typically what a reserve is. And the committee, that idea was not put forward or discussed at the committee, and I'm very hesitant to make such a significant change without proper time and deliberation. And I really, in any event, I'm just going to think about that for a second while maybe we need to hear from Neil.
I believe there was a seconder for the amended motion.
Jennifer, are you saying that you're seconding that amended motion?
Yes, and if I may, this is another good reason for committee of the whole.
But that conversation can definitely occur again with the bylaw review that is slated for 2025, Jennifer. I totally understand your reasoning for the committee of the whole, and at the time that it was discussed, it didn't have a majority of the votes in favor. So that's how we ended up with what we have right now. I don't know how to approach this amendment, and I'm now looking at Heather because I don't know that the impact of that kind of an idea in terms of the reserves.
Yes, I was just going to comment that looking at the impact of that on the reserves, along with some of the timing of the ministry settlement catch-ups that have been completed that I've reported on this year, that they will be recovering funds from the health unit in early January. And I'm not sure the impact that all of these combined would have on our cash positions without further study.
And we might not have sufficient funds to actually do that when we repay the amounts owing.
I just would like to make sure that our cash positions are stable and that, yes.
James?
So just for clarification, I thought our reserve level was approximately $1 million or just under $1 million. And the 77,000, in my opinion, would be able to be covered just from investment income.
I believe the recovery from the ministry, and Janet, you maybe have that number, but it's about $700,000 coming in January.
Mike, did you look like you were just about to say something there as our chairperson of resources?
I'm kind of looking at my screen and Neil's got his hand up, so I was kind of wondering what. That's what I was looking at, was Neil.
Okay, that's good. And Neil, yeah.
Good. Yes, I'm racing. I wasn't, I'm sorry, I'm caught off guard because I don't remember us discussing $1 million reserve, but I also don't remember discussing, or at least I didn't appreciate a $700,000 accounts payable back to the province. Was that? Okay. So really what we have is a
20.
reserve for 2025 of about 300,000. That's what we're.
And it's cash flow. So again, yeah, it's about six. It's between six. I can't see Janet, so it's between 600 and 700. It's on the financial statements. It's from long ago COVID money that was flowed.
Okay.
So it depends on the patterns of the cash flows from the ministry, and then when they take this money, so they will hold back payments in order to recover that funding. So we will be without funding probably for the month of January.
Perfect. And
Technically, cash flow.
we don't have a line of credit that we cash flow through. It's using that reserve.
The reserve could be used to back up that lack of
cash flow.
Yes, if we need to meet payroll. We have the payroll reserve. It's what do you call it? It's not dedicated. There's another name for it. When restricted. That's it. Thank you, folks. So there's a restricted reserve for payroll. And then I believe the remainder is general. There's a general. So I'd have to look. I'm not prepared right now, so I'm just going by memory.
Okay.
Again, I apologize.
And what I was curious, like I know I remember seeing the repayment on the audited statements. And is that the full amount up to the end of 23? Because we haven't had all the reconciliations from the government yet. So but we've forecasted what we believe it to be. Okay. I just wanted to validate that.
And that's the when we say they're in agreement with our financial statements. So the auditor at the end of each year says how much we owe or how much is due back. And so each year we wait, and then the ministry confirms. And if there's any questions or they don't agree, they think there's more or less. So those are already items that are on our financial statements, and they are amounts owed.
And your hand is still up, Neil. Did you have a follow-up on that?
Yeah, I'm good. I'll come back. I just need to think about what Heather just shared. I just need another couple seconds. Thanks.
If I could chime in, Joanne?
Please, and then Ethel.
So on the balance, I'm not in favor of dipping into reserves to cover the municipal levy increase for next year, primarily because most of the reserves that we have are dedicated to or restricted to certain purposes, none of which are directly related to operating. They're more reserve funds for things like payroll. There was an IT. There was one that was dedicated to IT upgrades, so that we made sure we had ourselves looked after that way. And most of them were thought through from that perspective. And this is not what I would consider to be an emergency situation. This is a normal operating decision that we're making today. And I also think that the municipal levy proposed, given the circumstances, is pretty reasonable with the circumstances.
And Mayor LaValle?
I'd like to move a motion, an amended motion that we table this until we can get the financial information to this board. And if I have a seconder, I'll give my rationale.
Jennifer, you're seconding the motion to table. And then Ethel, you could give your rationale. Wait,
Yeah,
sorry, you went back on mute.
I think that James's motion has some merit here. I'm not saying 100% that we should take it from reserves, but I think it's something that we should look at. And I think that in fairness to what Neil is saying, I think we need these figures in front of us as to what this really means, and it gives Heather the amount of time to do this. So that's my motion, why I'm moving tabling this.
And then Heather had a comment. Yes, Heather?
I also am not sure we can budget this way with taking from reserves. I'm not like I'm going to have to find out from the Ministry of Health Units can actually do this kind of form of budgeting where we're like it's a deficit budget, isn't it? So
Deficit
because
budget.
reserves are not income.
Right, we're not allowed to have a I don't believe we're allowed to have a deficit budget, by the way.
No.
So this
guys, if I may,
Jennifer.
These are levied dollars that are sitting in reserves. This is not a deficit budget. Pulling monies out of reserves to balance the budget is done across municipalities. I will also say on behalf of all of the elected that are on here, I'm not sure if the provincial appointees have heard about, I know Carolyn definitely has, about our OPP increases for 2025. It's our going into budgets, we're already in a disastrous situation. And this would certainly help out with our county budget. But this is not running a deficit budget by taking monies out of reserve. And I totally agree with Ethel. I'd like to see numbers in front of me. Also, the payback to the province. I'd like to see that exact number. And committee bringing this, but unfortunately, this is where the rest of the board doesn't have all the information. Thank you.
And we've got Neil, Peter, and Jason.
Yeah, thanks, Joanne. This is like an exercise in procedural bylaw. It's perfect. I support the amendment that Ethel put on the table. I just quickly tried to scan that documents folder that's on our portal, and I can't find the reserve list. So I think it warrants discussion later. The only acknowledgement that I would like to put on the table from Mike's perspective, from the chair of the committee, is that I still think it's reasonable for us to get information out to the obligated municipalities to do their planning now. And it may be something that we can forecast up to this certain amount. And at least then we could make sure that we have an approved budget for 2025, internal options for how we might fund it. We have the flexibility to review that later as per the tabled item, if it goes that way. Anyway, thanks, Joanne.
That's okay. And then Peter, and then Jason.
Thank you. I like Mayor LaValle, Ethel's suggestion. I think anytime we make decisions, they should be informed. And so to try and talk about reserves and using them or not using them, or what that means on the fly, I don't think is appropriate. And I don't think it's fair to staff to suddenly have to throw out a figure and then maybe send an email saying they're 100,000 off because they look too fast. Like it's not right. So I like the idea of tabling it, coming back with a series of reports, and then making a decision. I also, I think at some point, and perhaps Neil is correct, that we should probably send out an information or communication saying we're budgeting. This could be the increase, but we're looking at other options. I know it sort of makes you look unprepared or unprofessional, but at the same time, I think information is good at this point, and it builds a level of trust. So thank you.
And Jason.
Thanks, everyone. I just wanted to point out a couple things really quickly. Just first of all, that the major budget impact for this year is the 2% cost of living wage adjustment, and that will be ongoing. So, I mean, we'll be back at the same place next year. And then the other thing is that some of the savings, like the qualified donee or charitable status, that those have already been sort of taken into account in with this budget. So we're not expecting any major additional windfalls or whatever that would impact it. And then lastly, we did do some calculations of what the impact on the overall budgets for municipalities would approximately be. And what we're requesting, it's at the municipality with the highest impact, it's about a 0.13% impact. So it's relatively small. So I just wanted to make those points. Thank you.
So how about anyone we haven't heard from yet? Any other thoughts around the table, so to speak? And Troy, yes.
Thank you, Chair. I hear what other members are saying in regards to the potential impacts of a whole bunch of downloading that's actually occurred in terms of the municipalities. OPP, for example, is going to cost our residents a 3.35% increase in terms of the levy increase. So anything that we can do to mitigate some of those pressures would be prudent. That being said, I think it's of all the organizations that I've kind of are hearing from in regards to potential budget increases, the impact to the city of Pembroke is about $10,000, which really isn't a huge increase. Not saying that every dollar doesn't count, but that being said, understanding that the wages are going up and the various different caps in terms of the 1% funding. I don't think it's a huge increase. That being said, every dollar counts. So maybe it is an opportunity just to kind of look at, getting the information that's accurate information so we can make a more informed decision of how it would impact, our balance sheets if we do look at taking that, the total hit from reserves. But I do think it's important that we kind of, really understand what our reserve capacity is right now. And I think it's a good exercise in terms of, just accountability and, ensuring that, that we have the right information to make an informed decision. Thank you.
Any other thoughts before I try to summarize and we try to make some decisions? Any other thoughts? Neil, yes?
Yeah, and sorry, I'm going to be the stickler. I feel like the mayor of Edmundston Bromley right now. A motion to table isn't supposed to have debate. I just quickly Googled it. So it's supposed to be a straight up vote on that specific motion, and then we could get back, depending on what happens there, we go back to James's motion.
Yeah, that's kind of what I was thinking too. So thank you for checking that, because sort of like a motion to adjourn. It's sort of a non-debatable motion. So we have a mover, we have a seconder, we have a rationale. I'm going to call the question on the motion to table. And what we're tabling is the decision to change the recommendation of the resource committee. Have I stated that correctly? I'm checking with Mayor LaValle to make sure that I'm communicating back properly your motion to table.
I don't know that maybe that's the exact terms to put it in. All I'm trying to do is table this so that we get further information on our finances and that we're able to see it in terms of what we are going to not charge or whether we're going to take it out of the savings or the money that we have at the health unit as opposed to doing the levy. That's what I'm saying to the board that I think we should do. Whether that means we don't accept what the resource committee said or not, I leave it up to the people, the pundits that put that all together, but that's my intent.
I think if we table the motion, the motion to table is tabling the motion to adopt the resource committee report and the subsequent amendment motion, I believe. And Neil, did you put your hand up? Or I just want to make sure that we're clear in the minutes of what the motion to table is before we call the question.
Sorry, and if the motion on the table is to table the whole resources committee report, I would be against that. I still think that we can approve the budget. We're not fundamentally changing the fact that there's a $77,000 increase recommended by staff. That is not being debated. How we fund it is being debated. So I would want to just table the funding plan, not the actual budget approval. Now, if Elder Ethel, if you want to change I would not be supporting a motion to table the committee recommendation, but if it was just about funding, I would.
And so that would be tabling James's motion, which was about how to fund it. And Mayor LaValle's nodding. That was your intention?
That's correct.
Okay, so just I now want to make it clear. I see, Carolyn, I see your hand up. So let's make sure we hear from you too.
Okay, I'm just really confused. I think I followed what Neil just said, and that makes sense to me. That we can still agree on the resources committee report. Okay, because I mean, to me, the obligated municipalities, they need to know what to expect and budget for if it's going to happen. You know what I mean? So, okay, but this has turned into a dog's breakfast for me. I'm having trouble understanding this.
Okay, so the motion to table is to table the motion made by Mayor Brose. And then we'll come back to the resource report after that, because the motion to table takes precedence. Are we ready? I'm not seeing any other hands up. All in favor of tabling? All right, that motion is carried. And Troy, I see your hand up. Oh, you took your hand down. Okay. So what we've done is we've tabled the amendment for now, and we're going back to the Mike, yes?
I wanted to clarify one thing based on the notes I see in the chat. At the discussion at the Resources Committee, it was clear in my mind at least that we were not seeking approval of a budget. What we were doing was discussing a municipal levy based on preliminary budget, and that the budget was going to follow in January or February with a plan associated with it and a more detailed budget. Now we're starting to see conversation around approval of a budget. That was never the purpose of the recommendation from the committee. And we had that conversation that the budget would come back, the 2025 budget would come back through the committee to the board with the ASP.
Mm-hmm.
Okay, so now we're seeing that we may be approving a budget. It was
well, we're approving the report, and I think the report doesn't present a final budget in the report. So you're correct in kind of clarifying that to the group.
Right.
Jennifer? Jennifer? Are you
I
frozen? Oh, there you are. Okay.
Oh, hang on. I'll just turn my camera off while I speak here. I don't, I appreciate that this came out of a draft budget, but the entire board needs to review that budget, draft or otherwise. And I do appreciate Troy's comments that it's not a heck of a huge increase, but it is an increase nonetheless. I think this entire board, as Ethel very astutely said, needs all the information in front of us, reserves and all, so that we can make an informed decision for our ratepayers and for our health unit users. Thank you.
And Neil's suggestion and Mike's, I think, also were to at least communicate to the municipalities with what the estimate levy is based on the draft budget work. Then I think the suggestion to go back to the, maybe it's calling a special board meeting as a committee of the whole, Jennifer, so that as opposed to the resources committee, because the resource committee had the opportunity to look in more depth at these matters a week or so ago. So it's anyways, so, but not everybody around this table here is on that committee, understandably. I'm not sure how else we can get through this, you guys. So I would like to call Peter.
I think you're correct, Chair. I think, committee of the whole meeting to just review the budget is a necessary thing with the information, and I agree with you. And I think as part of the committee of the whole, if we could just kind of trace the budget trail and then use that next year, so that we agree in September, October, here's what's going to happen. It's going to go to resource, staff develop it, present it to resources, then it goes to a committee of the whole for the whole board, and then there's a decision made at the next meeting on it. So I think we've kind of worked out a good process in our conversation today. But I agree with you. Committee of the whole is the perfect function for a budget discussion.
Mike?
So I'm still trying to struggle with this in my head, because the discussion we had was not a budget discussion. The discussion we had was a funding discussion. It was where our sources of revenue were. It wasn't a budget. We didn't get into that level of detail at all. We had a one-page sheet. It was a funding discussion. The budget discussion is going to come in February.
We have a time-sensitive sorry, you finish. Pardon me.
Based on what we knew about where our sources of funding were, that is how the levy was determined. Okay. I will go back and say again, I do not agree with the use of reserves for operating purposes.
Mm-hmm. And I do see Jennifer's hand up.
And my apologies. I thought Heather put in the chat that it was a draft budget, so I assumed that there was a draft budget. I'm sorry, Mike. I didn't mean not being on resources. I wouldn't know.
No, it was called a draft budget, but it really, and the terminology I think was a little bit not correct. But anyway, it is what it is at this point in time. But it was never a discussion of budget. It was a discussion of funding sources. Mm-hmm. And the budget sheet showed us where the different flows were coming in and how the balancing was working out with the ministry versus our total operating costs. That's basically what I saw in it.
We do have an obligation to let the municipalities know. Hang on just a second. We have an obligation. Oh, sorry, I was trying to make that stop. We have an obligation to let the municipalities know as early as possible for their planning purposes. So I think in all fairness to our obligated municipalities, I think yes, Neil?
Sorry, sorry, Mike, and I now that we've talked about it a couple more times, maybe I should have spoke more to this at the committee meeting, but we've essentially said to staff, I haven't heard anything from anyone to say, let's spend more money. Staff have come and said, this is as low as we can get. And it's going to cost the obligated municipality $77,000. This is as low as we can get. Unless we're going to make a proposal to go higher, we've essentially got a draft budget. Unless the staff find another way to save money between now and when we approve a budget in January. So
yes,
I think the thing that's in front of us, I still think it's valid. You know, the terminology may not be exactly the way we want it to be, but I think the motion to accept the resource committee report is still valid.
And thank you for that. We may, who knows, get some kind of a windfall before the final budgeting work is complete, because there are things that the staff have mentioned as being still unknown in terms of the ministry. It's possible. I always have this hope that the ministry is going to sort of come through with something that they haven't told us yet. Troy and then Peter.
Thank you, Chair. Yeah, I echo the same sentiment as Neil, and it does say in the supporting documentation that it is a draft budget and levy recommendation. So if it was just a levy recommendation, I would suggest stroking off the 2025 draft budget. It says, new this year, we are presenting a draft budget, see table 1, in the supplementary information that's provided, along with the recommended levy increase. So maybe just in future, maybe we should just say, okay, this is the potential levy impacts, so that municipalities can plan accordingly, that we feel going forward would be appropriate, and give a range, because we haven't really finalized the budget, but that allows the municipalities to go ahead and plan for, in some cases, the worst case scenarios, right? And then if it comes in a little bit lower, at least they have a range that you would see those dollars in terms of knowing that the budget would be finalized in the new year or the early new year. So I think that's maybe just an opportunity moving forward that we could do that. Every dollar counts. I hear the pressures that everybody's under because of the constant downloading, but I do think that's an opportunity just to kind of give it a little bit of a forecast and not really talk about the budget. But I was a bit confused too, because it does say that they're presenting the draft budget. So and again, I hear what Neil is saying, if we're obligated to the city of Pembroke with a 0.03% increase in terms of levy increase, to me, that is a budget too, because it's not saying it could be from 0.03 to 0.06 or to 1% of the levy increase for the city of Pembroke in terms of its obligated municipality. Then that, it seems like it's set in stone. So I think we do have, we are kind of talking about a budget. Thank you.
Peter.
You and again, so what Neil has said really struck a chord, was that staff had come and talked about, here's how we can get down to this number. So I wasn't part of that conversation, and that's not an accusation by any stretch. But I think the board needs to know how we got to that number. Are we reducing the number of staff? Are we eliminating some positions? Are we not filling positions? Are we lowering our levels of service? Are we changing our hours of opening? So I think, I think those kinds of conversations, that information needs to flow to the whole board, just to get a sense of how. And congratulations to getting that. But I don't know how you did it. And so I think that's, I think that's part of the committee, the whole, is to have that conversation, and then be prepared. Thank you.
Heather, was there something you want to say?
Just that we had that conversation at the resources committee level, so about these things.
And that we don't get into that level of detail either, to get so granular with the operational, like we do have senior managers in place, and we don't get into every single granular kind of discussion either. And we know anyone who's managed any kind, and I'm sure most people know that the cost of doing business can fluctuate due to staff absences, and that you can have, there's almost, especially in a large organization, there's almost always some kind of a leave happening, whether it's a maternity leave or some other leave. And these things tend to just kind of happen, and they do have an ongoing effect, but we don't get into those kinds of conversations because of the personal specificity that would involve. Okay, so we've had a pretty fulsome discussion, and I think maybe, I don't know, are people ready? Is anyone still confused about what I'm about to do, which would be, we have a mover and we have a seconder for the Resources Committee report. We had a motion to amend that report, and that motion was tabled. So we're back to the motion about the committee report. Or is there any further comment or discussion before I call the question? I'm going to call the question. Oh, James?
Yeah, thank you, Joanne. So I just want to be clear then, the motion that is being tabled will be captured in the minutes of this meeting, correct?
Yes, because it's part of what happened in the meeting. You made a motion to amend, the motion was tabled. So the motion, when a motion is tabled, and it was tabled because the group wanted more information before they could consider it, because it was such a significant amendment. That's my understanding of what happened. Does anyone have a different understanding? And a motion that's tabled usually comes back when that information is available, right? So some
That's
heads
correct.
are nodding.
I just wanted to make sure that it's captured, so we make sure it's on the next agenda.
It's in the record. And then I wanted to restate the situation. Yes, Mike? And I see Peter's hand also.
So I'm not clear at all what we're voting on anymore, as far as the report. I'm lost. So I think it sounds to me the simplest way to proceed is to defeat the acceptance of the report, because otherwise it contains a tabled motion that can't go anywhere. So we sever the motion, the recommendation, one or the other.
And Peter?
Thank you. That I had two things. The first one was I agree with Mike to proceed forward. It's the report, say bullet point number 5. So we approved the rest of the report, but bullet point number 5 is exempt because it's the tabled piece in essence, and that's what I was going to suggest, just to try and get some clarity and to reflect it in the minutes. So that was my first thing. And once this is wrapped up, I have one more question before we vote.
But now I'm confused, because I was thinking that we still need to inform the municipalities about what the potential levy will be.
Well, if I might, I would suggest that that's probably the duty of the members sitting here to say, look, it's coming, but this is where we're at right now. Thank you.
And Mike?
I agree with Peter.
And Mike DeManoir?
I was just going to say, I tend to agree with Peter, because essentially at this point, we have nothing to, as the health unit, we have nothing to tell the municipalities officially. So we're better not to tell them anything. The municipal reps on the board can go back to the municipalities at this point and say, this is about where it's at. I think my understanding from previous is that by the end of December, we've got to tell the municipality something anyway, and it's got to be official. So whatever we do, we're going to have to move.
Yes, I know it's time sensitive. That's kind of my concern, is that we have a requirement to do something by a certain date.
Yeah.
Neil?
Yeah, given what people are saying at this point, I know the intent was to have to get to a point where we could issue this for the end of November. I distinctly remember having that conversation. I think it was in September that was the goal. But given the breakdown right now, I think I would just either sever the one item or defeat the thing. Has to come back. We're going to have a special meeting in order to set the 31st of December timeline with a committee of the whole discussion on the budget and finalize it then.
All right, so are we now ready to vote on the report? And is somebody making a motion to sever? Peter, are you making a motion to sever 0.5? You are. Is that seconded? It is. Troy has seconded that. So bullet point or nugget 5 has been severed from the report. Now we'll call the question on approving the remainder of the report. All in favor? And that is carried. So we've severed.
I don't know
Sorry.
what bullet 5 is.
1, 2, 3, 4, 5. The recommended, it's the point that discusses the recommendation for the municipal funding requirement for 2025.
I have it as resolutions bullet 1. Oh, you're taking that particular bullet out.
Of the report. I believe that was what I
In the resolution.
in
The whole resolution comes out. Which one were you severing, Peter?
I was severing the highlighted one that Melissa has highlighted for us, because the rest of the report, could go forward, and that highlighted piece also ties back to the tabled motion.
Yeah,
And I do see-
I think you want to sever the resolution. The whole resolution, because if you don't, you're still accepting the levy.
But the motion, that's why so what we've done is I made the amendment that we accept the report, save bullet point number 5. So whatever the proper language is. So I think, that was the idea, was to accept the whatever it is, 7/8 of the report, whatever the number of points are. So the intent was to still proceed with the exception of that one bullet. So if that's not the proper motion, then maybe we have to go back to it, but that was the intent.
Okay.
And Troy, did you have a comment on that? You had your hand up, and then I see you also, Jennifer.
Yeah, I kind of see where Mike's getting at. It's, it says, be it resolved that the resource committee recommends that the board approve the 2025 obligated municipal levy.
Exactly.
So that needs to be either revised. Yeah, revised. And then I see pulling out, the recommendation municipal funding requirement, that bullet. But I see exactly where Mike is coming from. Just approving that is saying that you're already saying that you agree to that levy increase. So for the city of Pembroke, it'd be a $10,000 hit. So until we kind of go back and look at the financial, how we got to where we were going, just to make sure that there isn't any adjustments that are needed, then maybe we should just reword that. So maybe we just kind of say, be it resolved that the resource committee recommends the board approve this report. And I think that probably solves that issue. Is that clear?
I respectfully think, I agree with Mike. I think we remove this entire item. I think I froze. I think we remove this entire item until committee of the whole gets to see a draft budget, how we arrived, and how we're funding it.
And Mike, you might be muted, or no?
No, I don't think so.
Oh, there you are. Good. Okay.
As it stands right now, the board has approved the obligated municipal levy and taken out the one paragraph of background. That's not what we wanted to do by the look of it, by the discussion. So I'm okay with it because it was our committee recommendation, but I don't think that's what the board wanted to do.
Isn't it simpler just to reject the report and then table it and then have it come back?
Well, the rest of the report is okay. It's only information anyway. It's only the
Right.
one, that's the resolution that's causing the issue.
Right.
So
And
the
the
motion,
resolution can be severed.
we made a motion to sever bullet point number or nugget number 5. I think that the severance should have included the resolution, to sever the resolution and nugget 5.
You don't have to do nugget 5 if you do the resolution. That's background. You just leave the whole
Okay, so
thing.
maybe we severed the wrong thing then. So we should have severed the resolution.
That's what I think. But it was Peter that moved it, so he's the one that understood what he said.
All right, Peter, it's up to you.
Okay, I still think, so, was the initial resolution moved and seconded?
Yes. And
So then all we have to do is, so we've already voted on the other piece to accept the report with the exception of number 5. So then Mike's correct then. If it was moved and seconded, then all we have to do is vote on that resolution. And hopefully it gets defeated and that evolves into conflict.
because so far all we've done is agreed to sever point number 5.
Yeah.
Right?
Yeah.
The other thing we do also have to always remember, and it's important that we balance the needs of the obligated municipalities, which our elected do an admirable job of representing. At the same time, we also have to keep in mind that our primary obligation at this table is the health unit.
Yeah.
Our first priority when we're sitting as directors on the health unit board is the health unit. It obviously is not in isolation from your responsibilities as municipal elected. At the same time, the health unit has to be the clear priority in the thought process and decision making. That's our duty of care under the act.
Yes, thank
It's
you. And
just-
I agree. And that's why my comments were about levels of service. You know, how do we get to that number? My comments weren't about the obligated municipalities. It was more about how do we get to that number, given the comments in the report. So I agree with you. I think we have done that, as a board really well. So yeah, I agree with you.
Right. So after all that, now where are we at, you guys?
So I think Mike's correct. That first motion has been moved and seconded, so we should vote on it. But we've also, at the same time, just passed a motion accepting the report. And maybe that's that's something going forward, is we should be accepting the report as well as the recommendations. And so, we did accept the report minus bullet point 5. And then, I think he's correct. We have to vote on the resolution.
The resolution was in the report, though. That's where I think I'm getting a little bit confused, you guys.
Okay, so that's why I asked if it had been moved and seconded.
But we already did that, right? When we moved and seconded the report included the resolution, so therefore it was already included.
Yeah. So again, my mistake. I was going back to my own practices, which calls for the recommendation to be read, moved and seconded, and then the report's given its background. So my mistake for not paying attention to that.
What's our path forward now? I mean, maybe knowing what we know, do we just I need my Robert's Rules of Order in front of me.
If I could suggest, Chair, that the board requests staff to set up a committee of the whole for a more fulsome discussion on funding obligations and potential sources of, and I'll use the term revenue, somebody could change that. And further, that the recommendation contained in the resources report about the, and I don't have it in front of me, about the obligated municipalities be removed and not acted on.
Well, we've already severed that, and that's not been approved. That was bullet point 5.
No, but the actual, as we've said, the recommendation on the front end of it that talks about the motion.
The top, that sentence at the top, that be it resolved that the resource committee.
Yeah.
This is where I'm still.
Because that's the reason, that's essentially the reason for the committee of the whole, you know, and there's been other things we've talked about, service levels and things like that. So I think but we haven't really talked about having a committee of the whole giving direction to prepare for it at the same time.
Well, I will call it a special board meeting
Sure.
because our bylaws don't provide for a committee of the whole. So I will just use that terminology of a special board meeting. And Carolyn?
Okay, somebody more learned than me has to help me out here. We did already approve the Mike's, if am I wrong? We did approve and so how do you go back on that? Like people that have done this a lot that know better than me, because I don't.
Well, you can reconsider a motion. The
You
mover
can.
and the seconder can bring it back. If someone who was voted in favor of it can bring it back for reconsideration. So, I mean, that's a possibility to us if we think that's what we need to do, is we actually reconsider the motion that we just approved.
So you
And
can.
we get the mover, which was Mike, and the seconder, who was, I think, Troy, if I
It was
remember
Troy.
correctly. And yeah, so Mike and Troy, and they agree or whatever to reconsider the motion.
Okay.
If that's
what I'm saying is, and here I'm agreeing with Peter, that if we can do that, then I think we should have that special meeting to have a committee of the whole for us all to be there and go over the budget again sometime in December. And boy, it's going to be tough for us all to be able to be there. But that's otherwise we're just going to keep sitting here and banging our heads. Like I've never been so crazily confused with what we're doing here. It's not good. Yeah. Okay.
Privilege.
Heather, I see. Okay, Ethel, I see you too, but and Heather, maybe Ethel, you've got your mic off. You'll go first, and then we'll get Heather.
I'm just a little uncomfortable in terms of my intent wasn't to throw this whole board into a frenzy today. If it makes it easier, I'm just throwing this out. I can withdraw this motion if my seconder is in agreement and start over to get us to this board meeting. But my intent is I would like to see more information in terms of finances, and I agree that we have to do this as a committee of a whole. I'm just uncomfortable with looking at a whole bunch of figures, and maybe that's just me, and trying to figure them all out and then say, okay, this is what the obligated municipalities are going to have to pay based on what we put forward. I would like to see options. For example, if we take it from our reserve, what does that mean? If we don't get this from the government, what does that mean? How many employees are we paying at what rate? I don't want personalities or names, but just having some idea where we are financially. So if it helps for me and my seconder agrees to withdraw this to get us moving today, I'm happy to do that.
Sure, but it's not your motion that's the issue, actually, Ethel, but thank you for the clarification there. What I actually think we need to do is go back to the motion we just approved and remake it with severing that top sentence as well. That's my thinking. And Heather, what were you going to say?
I was just going to say, I'm so confused right now. I don't even know what I could vote on.
Right. So my recommendation is that we reconsider the motion we just passed, which was to accept the resource committee report with the item nugget number 5 removed and severed. And as soon as we did that, we realized that we hadn't completely solved our problem, that we also needed to sever the statement at the top of that page, be it resolved that. Now, if I've stated that properly, Mike, I'm looking at you since you got us back going. Peter gave me the thumbs up. So the original motion, which was made by Mike and Troy, would be, they would agree or ask that it be well, anyone that voted in favor can ask that it be reconsidered. So is someone going to ask that the motion be reconsidered? Neil, thank you very much. We will now reconsider the motion to
You need a
and
second.
James has seconded that. James put his hand up to second that. Did you vote in favor of that last motion with the severed item, James? Because I think you did, because I think everyone's hand went up. So you're allowed to reconsider the motion. So we're going to reconsider that motion, and a friendly amendment to that motion is to also sever the be it resolved that sentence. So now the report would be put on the table with the exception or the removal of the be it resolved that recommends and the point that says the recommendation is. Actually, we should probably also sever the last nugget that still speaks about municipal contributions. So we would sever the references to the levy from the resources report, I believe is what you guys are telling me you want to do, because you want the opportunity to have a more fulsome discussion about the background information with more detail. And you want that to happen at a special board meeting so that everybody has the information. Now, is that a summary? Yes, Neil?
I just verified it. You don't need a seconder, but I
Okay.
move to reconsider all 3 decisions. I voted in favor of all 3. And essentially I want to revote on accepting the original motion. Do we accept the committee report? If we vote in favor, it will remove all 3, and then we'll be forced to go back and reconsider. Go back
Say
and
that again. Say that one more time so that everybody's following you. Thank you, Neil, for looking that up while we were, thank you.
moving to reconsider all 3. A vote in favor would negate all 3. And then we defeat the emotion, and then we vote again on the motion for Mike.
Yes.
Defeat Mike's motion. You as chair will be forced to call a special meeting in order to consider the budget proposal by the deadline. Done deal.
Perfect. That helps us out of this circular conversation. So Neil's made a motion to reconsider all 3. He doesn't need a seconder. So all in favor? That has carried. And I'll give Melissa a chance to catch up on that, which takes us back to the very first spot, which is where we're Mike and Troy are making a recommendation to approve the committee report. And Mike and Troy, are you okay with that? That reflects your understanding? Now I'm going to call the question on the committee report. All in favor? No, Mike, I can't hear you.
I would know because they didn't say anything. So at this point, Troy and I are moving acceptance of the report. Okay, what somebody needs to do now is sever the resolution from the report.
Or defeat the report. That
No,
was Neil's.
if you defeat the report, you defeat the other items in the report. And that means we have to bring them back too.
Yeah, just for the sake of the time, I would just say defeat the whole report. The whole thing comes back in the special meeting.
Because there's nothing else in here other than information. In actuality, there's no other decisions in this report. So defeating it doesn't hamper us any more than severing those items would.
So it creates more work for me going the next time around. That's what, because I'm writing the reports. sever the resolution, defeat the resolution, and make it come back, accept the rest of the report, and then it doesn't have to be rehashed again in another meeting. It's done.
Can we just move to amend? That's the previous authorization that was provided. And then just the amendment would just take out that recommendation in terms of the Board Resource Committee recommends the board approve the 2025 obligated municipal levy. That's
think
simple as
that's-
that.
I think that's what
Then
Mike
move
is
forward.
saying.
And then just continue on. And then what we can do then is, instruct staff to and the committee chairs to have a wholesome discussion in regards to how we got to the recommended levy, the recommended levy increases. I think that's as simple as that. So I would just move to amend the authorization previously provided in regards to the approval of the Resources Committee report, and the amendment would actually take out the recommendation in terms of the board approve the 2025 obligated municipal levy, and also remove bullet 5 where the recommendation of the municipal funding requirement for 2025 is an increase of $77,419 until further discussion.
So if I could recap what I think Troy is saying, is he's saying that the motion to accept the Resource Committee report should state that the report has been amended to remove those points. Mike, does that satisfy your desire to have the rest of the report approved, but the points with respect to the levy severed?
The report is the report. You can't amend the report. You can sever something from the report and deal with it, which is how we've been doing things in the past. Okay, so what somebody needs to do is move to sever the resolution from the report. And when that happens, then we're dealing
Jennifer's going to move that. And who's going to second that?
I will move that the resolution in the resources report be severed from the report, and let's move on.
Yes.
Carolyn is seconding that, correct? All right, so we've got a motion, we've got a mover, we've got a seconder, we've got a severed point. Okay, all in favor of severing? Those points got severed as outlined. All in favor of the motion to approve the report, given the severed things are out of it? All right. Is that enough people? Hands are up. Yes. Okay. We got through it. Well, that was a good exercise in refreshing some of the pieces of the Robert's rules, you guys. I was just thinking the other day that I need to get an updated copy of that and get my head around some of that. So moving on, thank you for your patience in working through all of that. I know it was confusing in moments, and I think we came to a good conclusion at the end of it. We will call at the end. I've made a note here at the bottom. We've got to set up a special board meeting, and we have to give the staff some time to prepare for that. And we have to do it all before the end of December so that we can still communicate to the obligated municipalities. I see you, Mike, and then Carolyn, and then Peter. Mike?
So the only other thing I want to throw in here now is that the board needs to be clear in its direction and expectations to the staff is what we need to see at a meeting, so that the staff know what they're dealing with and what they need to be prepared for.
Mm-hmm.
So we need to do that by way of direction to staff.
And then
I'm not
Peter?
clear what the expectations are anymore, so I'm going to stop there. But I think we need to be clear to the staff, because for all intents and purposes, I think now what we're doing is going to staff and saying for a special board meeting sometime between now and probably the middle of December, we're going to be looking for a full-blown budget. And
that may not be possible. The problem with the problem with that is there's still some unknowns. Like I saw Heather's face just kind of go in dismay. And I think it's because given other priorities that are underway and other reporting obligations, and given that there's still things that are unknown from the province, I mean, that's not fair to staff. We have to, anyways, Peter and Carolyn.
Thank you. And I was just going back to, for that meeting, the just the information that was provided at the Resources Committee, and that matches up that one statement about what they were able to do to reach the 1.3. And does that affect service levels? Does it affect hours of operation? Those are the kinds of things that I think the board needs to know, because I think we also recognize that there wasn't a lot of fat in the budget this year or last year. So to absorb the increase in staff costs and to mitigate that down to 1.3 is commendable, but what does that mean? So that's the kinds of things that I was asking. Thank you.
So Peter's keeping it high level at a kind of a board strategic governance kind of perspective. Carolyn?
Yeah, and all I was going to say is that it's not fair to expect them to have it done by the second week. I think we'd have to I think it would have to be during the third week, like before the 20th type thing, because if you expect them to have that done 2 weeks from now, I don't think that's fair to call a meeting. And anyhow, my bottom line is, can we decide on a date today? Because I am back and forth to Toronto in December. So, okay.
And Jennifer? And then Heather.
I would also like, as I expect others would, I'd like to see our reserve list, what is potentially an accounts payable back to the province, what's dedicated reserves and what is left over. And I respectfully disagree with Carolyn. I think if staff were able to provide to the Resources Committee to the point that they were bringing us a recommendation, this information should be readily available. Thank you.
And Heather, I think you had your hand up. Heather Czar? No? Okay. I don't think it was about not being able to present the same information that they already have. I think it was more about the possibility of unknown information in terms of a final budget. I mean, what I thought I heard at Resource Committee was we're not presenting a final budget because we're not ready to present and Heather, maybe you could clarify. Heather Daly.
That's right. It was preliminary.
And I think that it's possible, and we might have to live with the fact that there still may be things that the staff don't know that they have to estimate or use some planning assumptions for. And we still have to come up with the number for the municipalities to the best of our ability, given all of that. So all of that being said, we finished our voting on both of those motions, right? And in terms of direction to staff, is there anything else that anybody needs to say? And I'm not seeing any hands, so I'm going to move us on now to the Governance Committee. And that report will be calling Troy up to present for us. Thank you, Troy.
Thanks, Chair. So I have the pleasure of presenting the Governance Committee board report. The committee meeting was held on Tuesday, November the 19th. So what we did is we looked at the annual board self-evaluation reviews. I'd like to congratulate all the board because we did receive everyone's annual self-assessment forms in a very short period of time. So thank you to all board members for that. We just did a committee review in terms of just looking at a summary of the annual board evaluations, and we looked at the outliers in regards to some of the things that we think that there are opportunities for moving forward. We talked a little bit about some of the recommendations that came out of that annual self-assessment. So I actually was prepared to contact those members just to kind of understand a little bit more about some of the answers in terms of some of the evaluation points. And again, just to kind of see how we can address some of those concerns and opportunities for improvement. So the committee then will, I'll provide that information and we'll provide next steps in regards to the next committee meeting. And we'll also be reviewing the self-evaluation process. Some of the discussions around the evaluation process is whether we keep it anonymous or sorry, do we keep it where the individual is identified or anonymous, and then also maybe identify an opportunity to further explain. So just so we can get the information and really kind of see some of the recommendations. Some of the recommendations that already, in terms of what I'm hearing, actually we just discussed at our previous discussions in regards to maybe looking at the committee, how we're set up in terms of committees. So what we're hearing is committee of the whole opportunities, and also in terms of a little bit more visibility when it comes to financials. So it shouldn't be really any surprise. Based on some of the discussion that we've actually had just in our previous discussion. So some opportunity there. Then what we ended up doing is looking at our action list, and again, just to build on Heather's report, we looked at the risk management component in terms of the action list. And what we're doing is looking at, to evaluate the process that we use for risk management. So Heather, very timely in terms of the information that you provided in regards to the risk management processes and the information. But we'll having some more discussions at our future governance meeting next year in regards to that process. So any questions or concerns? Thank you, Chair.
Thank you. And seeing no hands up, I will call for a motion to accept the report. Mayor LaValle and seconded by Mayor Nicholson. All in favor? Oops, I did see Jennifer's hand up. I don't know if that was to second or not because you're off screen. Sorry, Jennifer. Or maybe that was voting in favor. And you're muted if you're trying to talk to us.
My apologies. Zoom just kicked me out.
Zoom kicked you out. Oh no. That's not good.
Yeah, I'm back.
Good.
I was just gonna move her second. I'm good. I'm voting.
Okay, that's perfect. So it's did I call the question? All in favor? I think I did that. Okay, carried. Thank you. So I got distracted there. Correspondence. Jason.
All right, so I can speak to the student nutrition program, the safety of private drinking water. So there's a letter from Peterborough Public Health about, and this is was brought up earlier actually, about the federal government's funding to further support our school nutrition programs. And so Peterborough Public Health was advocating for the Ontario government to work with the federal government and ensure that was implemented here. And we've since heard the news that that is in fact going forward. So that's some positive news. And as we've discussed at other meetings, particularly for children, adequate food security is essential for a number of health outcomes. So very important and relevant to public health. The other letter from Northwestern Health Unit is aligned with a letter that we actually just ourselves endorsed regarding ensuring that for private drinking water supplies such as wells, that publicly funded testing remains available, as there has been some indication from Public Health Ontario and the Ministry of Health that this is considered for being discontinued. So similar to us, they have endorsed ongoing funding for well water testing.
Thank you. And then I'm going to keep moving because I know we're a little bit over what people's probably expected for the time for today. There are no procedural bylaws on the agenda today. As has been mentioned, though, the governance committee will be starting its every 2 years a review of the bylaws, and that's scheduled to commence in 2025. And there's no other new business. The action list is item number 13, and Melissa's putting that up. We have not yet, we've been busy with other matters and have not yet arranged for the Kids Come First presentation in terms of the Ontario Health Team organized through CHEO for children across our region. And so that's pending. The database of future delegations, again, stakeholder committee hasn't met or had a chance to do that. So that, again, will be probably considered as part of the bylaw review in terms of the stakeholder committee terms of reference to see what, it hasn't met. Was there something that we should be having it to do, or is it a committee that's a legacy committee that actually no longer serves a purpose for us? I don't know the answer to that, but that'll be a question for the bylaw review process. The letter of support to Peterborough, Jason just talked about that, as well as the one for the safe drinking water. Both of those letters now have been created and sent back. So these actions will now be considered complete. The risk management reporting on item number 5 is there, that the governance committee will continue to look at that. And as was outlined by Heather earlier, we'll be heading into a new round of risk management and probably end up with additional board presentations to help ensure people are understanding and have their questions answered with respect to that process. The annual board of self-evaluation is complete, and the presentations on Mesa and the Heart Hub. Now, I know we had a very excellent sort of initial synopsis today with Jason, but I think there was that suggestion that we have that at a future health meeting as an education item for us. And other than that, I think our actions out of this meeting are to have a special board meeting in December and to come up with that date today, if at all possible. So that's the action list. There's no closed meeting to go into. So we are actually at the date of our next, Mike, yes?
Just wanted to make one comment with respect to the correspondence, and that was in the info break. Wanted to congratulate Melissa on the shout out that she received.
Nice, thank you. Thanks, Mike.
Thanks, Mike.
And the info break is actually something that the Alpha people continue to remind us of its value. So thank you and they were pleased to report that many boards distribute the Alpha break to the board members for board awareness and education. So thank you for that. So get out your day books and let's see what's possible for December. And then the inaugural meeting is usually the second Tuesday. And I wanted to find out, or at least to let you know, that one of my notions was to ask Melissa to do a meeting poll to see whether January the 7th or January the 14th, the first Tuesday or the second Tuesday, would give us the best attendance for the inaugural meeting, which the bylaws say is usually the second Tuesday, which would be the 14th. And given that the second Tuesday is kind of late in the month this year, just the way the weeks roll, I thought it would be good to check with everybody now, like ahead of time, about whether the 7th or the 14th are better. So that will probably go out in a doodle or some kind of poll with Melissa, just so you know. And then the December meeting. So I'm rolling my day book back to December. And I'm looking at the week of the 16th to the 20th, but not the 20th, which is the Friday. But I'm wondering on that Monday to Thursday, 16, 17, 18, or 19. And I think
anything but Monday for me.
Pardon me? Not
anything
Monday?
But Monday for me.
Anything but Monday. Okay, so forget the 16th. So now we're looking at 17, 18, and 19. Does
I'm
anybody
not
have?
available on the 18th.
And Ethel's away on the 18th. So we need it to be the 17th or the 19th.
The 17th isn't great for me. It's my council day, but as long as we're wrapped by noon, I can do it.
And what about anybody else? What about the 19th? Is everybody good for Thursday, the 19th? Because if so, let's not put extra stress on Jennifer with her council meeting so she has time to prep and do anything else she needs. Okay, show of hands, 19th. All right, Peter's not in the room, but let's trust that it works for him. Troy, I see your other hand up. Or, oh, no, that was, okay, sorry. You're voting with your magic hand and your real hand. Okay, I get it. So we've now set the special board meeting in December for December the 19th at 10 o'clock. Going. Okay, good. Thank you. That was awesome, you guys. Like, for all the difficulties or whatever of trying to figure out what the right thing to do is, working together, I feel like we did muddle through to something that kind of made sense and hopefully will stand us in good stead going forward for the sake of the public health unit and all the people we serve. And I think before I call for adjournment and a resolution to adjourn, Vicky wanted to say something to us.
Thank you, Madam Chair. First of all, I'd like to say thank you to Joanne and board members, to Jason and Heather. Thank you so much for your kind words. I'm really filled with a lot of emotions. As I prepare to retire after 24 years, lovely years with the Renfrew County District Health Unit, I reflect on what an incredible journey it has been. It truly has been an honor and privilege to serve the residents and communities of Renfrew County and District. Being part of an organization dedicated to promoting and protecting the health of all has been one of the most rewarding experiences of my life. Over the years, I've had the privilege of working alongside remarkable, talented, dedicated team. Their passion, their resilience, their commitment to our mission have been such a source of inspiration. Together, we face many challenges, including a pandemic. We've celebrated many successes. Together, we remain committed in our goal of improving the health and well-being of the people we serve. To the Board of Health, thank you for your leadership, your guidance, your advocacy. You have played a vital role in shaping the work that we do at the Health Unit. It has been a privilege to collaborate with you and to witness your commitment to ensuring the highest standard of public health governance. As I close this chapter, I leave with a deep sense of gratitude and pride. I'm confident that the Health Unit is in good hands with Jason, Heather, Patty, and Janet. And I look forward to seeing the continued positive impact this organization will make in the years ahead. And again, thank you so much for your support, your trust, and the opportunity you've provided me with throughout this incredible journey. I'm greatly grateful to have been part of this amazing team. Thank you again. And I will miss you all.
Thank you, Vicky. Beautiful. Now I think we can call for a motion to adjourn. Jennifer's ready to move that. Seconded by James. All in favor? Carried. Thank you all.